Michael Fuchs, the host of Ancient Arts for Modern Times. Our very special guest tonight is Melissa Falvo of the Center for Higher Living in Berlin, Connecticut. Welcome, Melissa.
Thank you for having me.
Thank you for being here. And tonight we're going to be doing a show on massage and bodywork, which are ancient arts, which I think many people have heard of and know about. But we're going to do a show on it, and hopefully you can learn more about it. First of all, about this show, Ancient Arts for Modern Times, I kind of left the title kind of wide open. Like, what does this mean? Well, I myself have been involved in Asian martial arts and healing arts and meditative arts, things like Chinese and Filipino martial arts and Tai Chi and Qigong and Reiki healing arts and all sorts of stuff like that for close to 40 years now. I've written some books and many articles and done all sorts of different programs and things over the years. And I was just thinking that there'll be, there's, 40 years ago when I began, if I mentioned Tai Chi, people thought maybe I hiccuped. They weren't even sure what that was. There is much more knowledge now of many of these ancient arts, but still they're fairly new in our culture. So I figured, well, let's do a show where we can bring in experts in various ancient arts like massage and bodywork, and we can talk about them and hopefully educate the public, and people can avail themselves of them because they're so helpful for our health and enjoyment. So tonight we have, again, Melissa's with us, and I thought maybe Melissa, before we get into the nuts and bolts stuff, maybe you could just talk about yourself and your background and how you came to be a massage therapist.
Sure. Thank you again for having me. I have been doing massage now for 14 years and have a private practice within the Center for Higher Living. Prior to massage therapy, I was a stay-at-home mom, and then prior to that, I was a research scientist. I have a master's degree in biochemistry.
Wow, that's awesome.
Thank you. And did cancer research for a number of years, and then left that profession to raise some beautiful children. And when I decided to go back into the workforce,
You needed some massages yourself. I'm sorry.
True. This is very true. When I decided to go back into the workforce, I, as a runner, had always gotten massage throughout my lifetime and thought, well, what a better way to bring the science of physiology and anatomy together with my personal knowledge of receiving massage, and that's why I went to school.
Well, that's wonderful, and yeah. I mean, many people now go through a change of career, so I think that's a great example for people to learn about.
Yeah,
and
absolutely.
It's quite an interesting one, from scientist to mom to massage therapist.
Yeah, I mean, there is a lot of science behind massage therapy. We have rigorous education now for the profession, and we have to get continuing education classes every couple of years. So there's a lot of anatomy, physiology, certain knowledge of muscles and how they work and where they insert and how they make your body move, and all of that is really important for us to know as therapists. So it's not just a,
Right, that was something we were chatting about before the show started.
Yeah.
Is that massage and bodywork, they're actual acknowledged forms of therapy, like physical therapy or psychological therapies, and these people have to go through rigorous training, certification, continuing education. So yeah, maybe you could talk about that a little more.
So
how that works.
Sure. Each state is a little bit different, but in general, there's between 700 and 900 class hours for the licensure for massage therapy, and that includes anything from like I said, anatomy and physiology to hands-on training with your classmates. And it also involves things like contraindications and immunology and lots of different,
Sure.
yeah,
The whole.
the whole system, all the systems of the body
Mhm.
are affected by massage. So in school, we learn all systems of the body and how massage can
So
affect those.
people watching this and maybe that are interested in having some massage and body work, they can be confident that if they see a licensed practitioner, that they've been very well trained.
That is absolutely right.
Right.
There's 45 states in the union that have licensure requirements. There are still some outliers,
Yep.
but if you if you look at the biography of the massage
Sure,
therapist, LMT, they have gone through rigorous
And
training.
LMT is a licensed massage therapist.
Correct. Yeah.
Awesome. Great.
Yeah.
Well, that's awesome. Great. Now, let's talk about massage and body work. What are some of what would be the differences and what would be the similarities?
So bodywork is sort of an umbrella term to include things like massage, shiatsu, which is movement and stretching of the body, usually on the floor. It also includes stretching or using various tools, cupping, for example. So bodywork is basically an umbrella, and massage therapy is one area of bodywork that people can get specific training in. So you need a different training for shiatsu or the various different kinds of body work.
So massage would be body work, but if someone says I'm a body worker, the logical question might be, well, what kind?
That's right. What modality do you practice?
What are you practicing?
Correct.
Okay. You mentioned shiatsu. While that has brought up, now that's a Japanese originally?
It is.
Mm-hmm. And that's something I wanted to mention is that while here in the United States in the Western world, massage and body work as therapies are maybe a little newer, in Asia, the Middle East, India, Egypt, other ancient countries. I mean, this goes back centuries and centuries.
That's correct.
Right.
Yeah.
This isn't new.
This is not new.
It's true ancient arts from modern times.
Absolutely. In the United States, it was first sort of dabbled in the 1900s when women would help post-operatively, help the physician to increase circulation or joint mobilization. And now, it has certainly evolved.
Well, I think our healthcare system more and more and more is slowly changing to where it makes more sense if we can take care of ourselves and stay healthy, then, it makes more sense for us and for the insurance companies to try to, prevent illness from happening. And I think,
That's right. So often there's a misconception out there about massage therapy being a way to pamper yourself or, hey, I'm going to go for a spa day. But really we like to,
and that's part of it,
and
though,
that's
right?
part of
Sure,
it,
right.
100%.
Yeah.
Relaxation,
Everyone deserves that.
decreased stress and anxiety, for sure. There's a list of things that massage therapy does in all forms. But we also, the majority of people can really get therapy with massage for a variety of things, including anxiety, depression, increasing your immune system, but also if you're training for something, massage can help you get from one training cycle to the next, decreasing pain and discomfort with muscle use. There's just
you say training like physical training.
Physical training, physical training. So there's the physical side of massage and there's the mental benefit of massage, and really it's a whole body preventative healthcare and wellness piece of the puzzle.
Absolutely.
That sadly the healthcare system in the United States does not embrace.
It's changing slowly, but
Yet we're working on it.
Right. So I can give an example myself. I've been involved in martial arts for close to 40 years, and as a student with my instructor, I was training every day for hours a day. At a certain point, I took over the school from him, and then it went to like 10 hours or more almost every day. I'm training, and in the types of martial arts I do, there's lots of stance work, down low, holding still, and even though I was stretching every day, I got to the point where I could barely walk. My thighs got so bound up.
Right.
And I knew about massage and body work, and I have a friend that specializes in deep tissue massage, almost like Rolfing.
Mm-hmm.
And I went to her, and she used her elbows, and I was black and blue for a couple weeks.
Ouch.
But it was something after that I could walk fine. She really, whatever was going on, through that deep tissue massage really helped me.
Right.
It didn't feel so good at the
Yeah.
time. But,
Yeah.
and also you mentioned, I think this is fascinating, that massage and body work can be part of someone who might be undergoing some personal transformation, change in life, different kinds of psychological therapy. It can be a great support for that.
Absolutely. Massage can decrease stress levels and anxiety, lowers blood pressure. So if there's someone who is, well, we all go through a lot in life, right? And so by maintaining a therapy schedule, a massage therapy schedule once a month, however you and your therapist set that up, you can try to keep those anxiety issues at bay while life gets a little crazy. So yeah, it's a great form. So many applications. Scar tissue help, shoulder reconstruction help, lots of post-operative care we do. And there are people, massage therapists are trained at different levels. We're all trained to a certain level, and then just like a physician, we go off and learn specialty things. So if you're, be mindful of who you go to when you're seeking certain aspects of massage therapy, because the training changes a little bit right after we get out of school.
I think let's talk about that now. So some of the different modalities. So there's, Swedish massage, which I think if you mention massage, most people are thinking of that.
Right.
But there's so many other types of modalities. Maybe we could just talk about some of them a little bit and what they are and what they're good for.
Sure. So Swedish massage is what most people think of massage. It's a light touch, decreases blood pressure, very soothing, relaxation, that kind of thing. There's deep tissue, which you had mentioned, which really dives in, no pun intended, to deeper tissue in the body so that we can create some space and decrease the friction that happens between muscle groups and the tightness that you get when you use certain things excessively, right? Deep tissue, for example, can be, not everybody likes it, but it's all relative. That pain scale is all relative. Yeah. But most of the therapy with deep tissue comes when you can hang out in the uncomfortable part of things. Pain, not necessarily great, actually not great for massage at all, because the brain then says, oh no, right. I'm hurting, and the muscles actually contract. So there's a fine line in deep tissue work between the uncomfortable and the painful, and we want people to stay in the uncomfortable so that the therapy can happen and the muscles can relax. Okay. Right? So we also can do...
That makes sense.
Yep. There's also myofascial release.
Myofascial release.
Yes.
So what is myofascial?
So myo is muscle.
Okay.
Fascial relates to the connective tissue in your body, the fascia. Yep.
Okay.
And so the technique is a little different. It's a lot slower, and it's designed...
So it's geared towards that level of the connective tissues, not so much the muscles are under them.
Correct.
Interesting.
Yeah, well, the fascia system is all throughout your body. It intertwines the muscles and organs, and it's everywhere, kind of like a spider web, right? So if you do myofascial work and touch the fascia, say on somebody's foot, it really is a chain reaction up throughout the whole body because it's all connected.
I've not experienced it. I've heard about it.
Yeah. So it's slow and there's not a lot of oil used at all, so it's not slippery.
Why would someone have myofascial body work?
Most often with an accident or an injury. So if you or surgery. Okay,
so there's trauma and it helps to relieve it?
That's correct. So with trauma, like a blunt force to your leg in soccer or whatever, you would get a bruise and a tightness in one particular spot. And because it's an outside force, the body reacts by holding tighter to prevent pain. And so it's that release that is
I wonder if that could even be from like a severe, say, a psychological trauma or something like that. 100%. So
part of the psychological trauma that research has out there now is including some folks with fibromyalgia. right? So the body is interpreting that trauma, right? So myofascial release is very helpful with people with fibromyalgia for that, right? It's not painful, it's not deep, it's very gentle. Yeah. So yeah, and there are other things like cupping I had mentioned, and stretching is involved.
So cupping, that's originally from like Chinese medicine.
I believe so, but don't hold me to that. Yeah, outside the scope of my practice, I've not been trained in it.
I plan on doing a show on more like Asian bodywork.
Yeah, yeah, but people might know Michael Phelps, right? Went to the Olympics with all these like spots on his back and on his arms. That was from cupping.
I've had it done.
Yeah. So the idea with all of these different types is the end result we want to decrease pain, increase circulation, right? Increase movement. They just do it with a little bit of different, ways in which massage.
Well, I mean, I think the goal is to have whatever higher level of health and balance for mind and body, and they're taking different pathways.
Right, taking different pathways. Yep.
So now, some other types of massage. There's trigger point, sports massage.
Yeah, really anything you can think of. There's a little niche in the massage therapy world. Sports massage, for example, pre-race or event is a different kind of massage than certainly myofascial release, right?
Sure.
So we would increase the circulation in large muscle groups that are going to be used depending on the sport. And then after the race or sport or whatever, it would be more of a flushing out all of the, toxins, so to speak, of, increasing the length of the muscles that you just used and decreasing recovery. Yeah. What other ones did you have?
Is there any other ones that you feel you'd like to mention, or?
There's massage for cancer patients. There's
so specialties, right?
Yeah, so it's again these are all specialties. Right. Some of which I do not do, but other folks do.
You have more knowledge than I'm sure most of us.
Well, hopefully.
I know there's this massage people that specialize in working with seniors and children.
Yeah. Yes. Any of these specialties require continuing education classes outside of what we learned in school.
Sure.
So not just anybody can say, hey, I can work with cancer patients, right? Because that's a specialty. Or not everybody can say, hey, I can work with pregnant people because, right, that's also a specialty.
If a client is pregnant, they need to see someone that's licensed for that specifically?
That has greater education, yeah. So it's not, so we get certified, I guess, in the different specialties, above and beyond the licensing of a massage therapist. Okay. Right. So yes, you would, if you are.
So they would look for someone with that kind of training.
Absolutely, 100%. Because there are nuances to each of these specialties, and contraindications change depending on what the body is going through, pregnancy or cancer or sports, whatever, right?
So contraindications meaning like
we shouldn't go there.
The therapist needs to watch out for.
Yeah.
To keep the
client safe. That's right.
Okay.
That's right.
Okay. Interesting.
Yeah.
Okay. So now, well, that's great. So let's talk about, so how would you recommend people approach this if they just wanted to try it?
So there is a governing body of massage therapists within Connecticut and throughout the country called the American Massage Therapy Association. Okay. AMTA. Their website, amta.org, has a drop-down menu where you can search in your location for licensed massage therapists, and that's where I would start.
amta.org.
Correct.
Okay.
And word of mouth is always a great way.
Of course.
Your mom or your friend or whoever has a massage therapist that they like. Google is another way to see who's in your area. So, and we at the Center for Higher Living have 7 massage therapists currently.
So the Center for Higher Living, that's that's your establishment in, it's Berlin, Connecticut?
It is in Berlin,
And
yes.
I must confess, I teach Tai Chi classes there.
And
That's
we
how-
love having you there.
That's how we know each other. It's absolutely gorgeous. I have no financial stake in it other than I teach lessons there, but it's an absolutely gorgeous healing arts facility with body work, all sorts of different things happening there, yoga and Tai Chi and
Yep.
body work and massage. And now body work and massage, they also bridge into like energy work.
Absolutely, yes. Some of our practitioners are Reiki certified, which is one form of energy work. Also in need of certification and licensing. So people, at least at the center, have all their ducks in a row. The education is there. Just be mindful that not every state has those certifications or licensing requirements. So,
Sure.
be mindful.
Always good.
Right.
Let the buyer beware.
That's right.
If it
That's
sounds
right.
too good or you're getting a weird feeling, find someone else.
Yeah, yeah.
No, I think most people I found, they're very sincere. People that practice, massage or Tai Chi, but it's still, you want to kind of get to know who it is you're going to be working with. But most of them, they typically oftentimes start out as clients themselves and liked it so much that they wanted to
That's
get
right.
into it.
That's right. Most of us have.
So, right,
Yeah,
right.
yeah.
They benefit from it, so that's how I
Right,
started. I needed to be healthy and loved it so much, I started teaching it.
right.
Still at it.
Yep.
So, okay, that's great. So now, so people can just try massage, in body work, as you say, just if they're interested. But also, you mentioned earlier how it can be part of a wellness like program or paradigm, and how would that fit in, or what are some other things that might go along with that, given your experience running a wellness center?
Sure. So, health and wellness is a big. I'll use the term umbrella again, right? It's a big
Yep.
umbrella, and preventative care and holistic preventative care is sort of what we at the center want to do. So, for example, I have some clients who are recovering from injury and go to PT, physical therapy,
Yeah.
and as their massage therapist, I coordinate with the physical therapist
Right.
on how best to help them
Sure.
through recovering of their injury, right? This can also happen with your physician. We're happy to discuss protocols or what they think is best in terms of
Do you find
helping.
that, I'm sorry to interrupt, do you find that physicians are knowledgeable about body work and
No.
massage? Physical therapists are.
Physical therapists are.
Right, I used to work in a rehab hospital.
Yeah, we try to educate
Right.
any physician
Right,
who would listen,
Yeah.
but are in general.
Right.
No.
Listen, I understand. I'm not trying to knock any
Yeah,
doctor.
yeah.
It's not what we're trying to do.
Correct.
Right.
Not at all. In fact, we would love to educate them on how much.
I always tell people you can do Tai Chi, you can meditate and practice Reiki, and of course you go to the doctor, and I would tell the doctor, you can do your thing, but you should be doing this too,
That's exactly
It's
right.
like diet, right? We all should be eating well.
Yeah, I mean, I think
It's
that
all part of a puzzle. Nothing takes the place of anything else,
100%,
so we're not in conflict.
and I think that
Right.
we can help one another coordinate the best practices and healthy living for the majority of people if we would interact more.
Absolutely.
And as a profession, we are trying to encourage that. We have been for years.
Again, that's part of why I'd love to say I have the audience of Oprah Winfrey. I don't quite, not yet. But that's part of why I want to do this, is to educate everyone.
Right.
So if you're a healthcare provider out there, professional, and hopefully you're learning something here, and the quote unquote average person. I want to just mention, since we're kind of, again, I'm a Reiki practitioner for many years and written books and whatnot. That's pretty much unregulated, so anyone could say what they want to say. But I was one of the first integrative medicine consultants licensed through St. Francis Hospital in the late 90s. And I used to go to the hospital on like Nurse Appreciation Day and
Yeah.
whatnot. I had the swipe badge, and what are you doing? I'm a Reiki practitioner, huh? So I had a lady doctor sit down and try it. And she goes, I don't believe in this stuff. Okay.
Right.
After about 5 minutes, she fell asleep, and I was holding her up in the chair. And then after 15 minutes, I kind of gently woke her up, and she goes, wow, that works. I said, That's why I'm here.
Right.
I didn't bribe my way in here.
Right,
But
right,
anyway,
right,
so
right.
there's
Well, I think that people, are becoming more aware
sure, right.
of the non-Western medical side of health and wellness, right? And so there are so many parts to that. Energy work is one of them. Massage therapy and body work is another. And, head therapy or psychological therapy, that's another.
Head therapy.
Sorry. Yeah. It's
I like that.
Head therapy.
Gotcha.
Yeah. Yeah.
I need some notes.
Well, I mean, the mind and the body are so
Of course.
closely connected,
Absolutely.
and so all of those therapies are helpful for generating that healthy side of a human, right?
Of course, right.
Yeah.
Okay, beautiful. So now, is there anything else you'd like to talk about that's on your mind about the massage and body work that you wanted to share?
Well, I think it's really important to remind folks who haven't tried massage that it's not about body shape or size or gender or color or anyone who wants a massage is welcome to receive because there I don't know how to put this in words. We are accepting of all,
Of course.
right? A human is a human is a human is a human. So try not, if you're afraid to try massage because of your body size or, you don't have a toe or whatever it is,
Of course.
please don't be afraid.
Well, I think that's a good point. And again, licensed massage therapists and body workers are professional, and of course they're in that field because they're compassionate. They want to help people. They wouldn't.
Yeah.
Why would they do this?
Right. Very good point.
Right.
Right. So as a new,
I think
yeah.
sometimes being compassionate to ourselves can be very challenging.
Well, and
difficult.
very
I think
difficult.
Massage and body work can be a way to help that. For someone that might have an issue with that.
Right. That's right. Love yourself.
Right.
Yeah.
And it's a very safe, nurturing type of touch for someone that might have issues with that.
That's right. And even for along those lines, for elderly folks or people who live alone,
Absolutely.
this
Right.
kind of safe touch is so important for your immune system. If you don't have that interaction, your body will let you know that things aren't quite right. So coming for a massage will help increase
Absolutely.
that.
Well, again,
yeah.
I don't need to tell you, but touch is one of the most important things a human can have, and nurturing, loving touch, and loving, of course, we mean in a compassionate way.
Right.
And unfortunately, not everyone, too many people don't have that.
Right.
Or maybe they've only known violence or something.
Right. I agree.
So this is something very, very important.
Right. And there are therapists on that note who are trained in trauma therapy. So they have a better understanding of someone who has been through trauma on their table, because a lot of emotion can come out with this kind of during massage therapy and this kind of touch.
That is most definitely, you want to have special training for that.
Right. Right. So whatever you're going through at the moment or in the past or whatever you think about massage therapy, reach out to me at the center or the AMTA.org to find out more information about where you might find the practitioner that's right for you, because there's one out there. There's more than one out there, but you'll be able to find one that you're most comfortable with.
How many, about approximately, would you say, in Connecticut, licensed body workers and massage therapists are there? Thousands, right?
Yeah.
There's all over the place, right?
Yes. COVID really,
Of course.
closed a lot of businesses because we weren't working for so many months and people chose to
It's not
go
good on
another.
Zoom. Massage on Zoom doesn't work so good.
Sadly, when states shut down, so did we. So we had no work for that
Me too.
time. Yeah, and so some businesses couldn't come back from that or haven't come back from that. So fewer now than pre-COVID, but still, it's
Oh, yeah.
there are plenty of massage therapists out there for the number of clients. Yeah.
Okay. So, well, listen, Melissa, I want to thank you so much for agreeing to come down here and help enlighten us about the fascinating world of massage and body work. Again, now let's talk about if someone, this is something else, if someone was, say, was interested in pursuing this as a career, how does that work?
Yeah, absolutely. So there's one school in Connecticut. No,
wow.
that's not true. The Ashnuntuck Community College has a program
Okay. In
and
Enfield,
in Enfield,
as Nuntuck Community College in Enfield.
hmm and Cortiva Institute in
Yeah.
Cromwell
Okay.
has a program. And as far as I know, those are the
Wasn't
only
there
two.
one in West
No, West Hartford.
Right.
Yes. Whose name I forgot.
I know right where it is, and I'm having a brain. There's
Yeah.
a great school in West Hartford too.
Yeah.
I taught Tai Chi there.
Yeah.
I'm
So
having
I
a
mean,
brain
you
lock.
can go, you can
Okay, so there's
Google.
schools that you can go to.
Yeah.
Now, would there be online training, or is this something?
No,
all
there's no
in person?
online
Right.
training because
Yeah, it's hands-on. of course.
it's a hands-on.
Right.
Yeah. So part of the schooling is didactic, but most of it is hands-on training where you
Now, I know it
interact with
used to
students.
be. Didn't Connecticut have like some of the very highest standards in massage therapy?
Connecticut has high standards.
Mhm.
Florida has high standards.
Florida.
New York.
New York, yeah.
Yeah.
Hawaii, maybe.
I don't know about Hawaii.
I'm just going by
I don't
what I've
know.
read in the past.
Yeah, I don't know. I was trained in Tucson,
Okay.
Arizona.
Mhm.
So each state has different
I think
standards.
Connecticut has very high standards. So if you find
Yeah.
someone licensed from Connecticut or New York, and I'm sure many other places, but you know they've had good training.
Well, if
And how long would a training, like a basic standard training program, go for?
it's 9 or 10 months full time.
Okay.
You can go part time at most of the schools at night if you have another job, and that would be depending on the school either 12 or 15 months.
Okay.
Because it's based on hours of training, so
Right.
it depends on how they split that up.
Okay.
And in order to practice in any state, you need a license in that state, so they're not transferable. Right.
Okay.
So I had a license in Arizona, and now I have one in Connecticut. Yeah, I know. They're working on being transferable, but
yeah, right.
it's not yet. You still need a
Okay.
license in the state in which you work.
Okay.
Yeah.
All right. Well.
Yep.
Okay.
Yep.
All right. Well, it's definitely a great field, and I think it's going to be a growing field. You know, again, as the idea of preventative health and maintaining health becomes more and more popular, especially with newer generations. So, all right. Well, again, Melissa, I want to thank you so much. It's been a
Thank
pleasure
you.
chatting with you,
Likewise.
and thank you for joining us here on Ancient Arts for Modern Times. And stay tuned because we have more shows planned and in the works. If you have ideas on shows, just contact Weathersfield TV, and we'll certainly look into doing that. So again, thank you so much. I'm Cecil Michael Fuchs, Shaolin Butterfly, ShaolinButterfly.com, and I want to thank our very special guest, Melissa Falvo of the Center for Higher Living. It's truly a beautiful center for higher living in Berlin, Connecticut. And of course, thanks to everyone here at Weathersfield TV, and you have a wonderful night. Thank you.